Our guest speaker for our health professional webinar is Dr. Rodkey. Dr. Rodkey received his doctorate of dental medicine from Oregon Health Sciences University in 1997, and he went on to complete general practice residency for dentistry at the Portland VA Medical Center. Dr. Rodkey has practiced in a variety of settings, including clinics and his own private practice. Dr. Rodkey has provided services for correctional and hospital institutions, as well as private dentists. In addition to performing hands-on dentistry, he performs independent medical examinations and professional witness testimony services for dental injury claims.
Well, I didn't start out in dentistry. I actually started out in engineering. I grew up actually in a medical doctor family. And so that was most of my exposure growing up was to health, and then also to science, various areas of science. And I ended up going in a direction different than some of the family members. I went into the engineering field and ended up with my metallurgy background, and then also onwards with material science. One of the things that I found that I lacked when I was in the engineering field was the interaction with people that I could get involved a little bit more in their lives and try to provide some kind of help. There was something missing in what I was doing. And so actually my dentist and then a friend of mine that was going to dental school at the time were both good encouragements to me to look into the dental field. And so I ended up switching over from engineering to dentistry back in 1993, finishing up in 97 with my one-year residency program after that. It comes down to a question of providence, and we really believe that providence was involved here because we were in a family crisis at the time. My father, who was 91 years old at the time, had slipped and fallen on what we call black ice up here in the Northwest, and came down on his head and had a severe head injury. And 1 month following that, he'd had some bleeding on the brain, which ended up continuing to swell. And he went into major brain surgery 1 month to the day of when he fell. And during that time, my sister called me all excited about some new solution that I could sneak into the hospital and give my dad. And I wouldn't have any part of it. I didn't feel it was proper. I did not know anything about what it was she was talking about. So anyway, I went the following week down to Portland for a education seminar, and during that time I saw a presentation with my sister about these Redox Signaling Molecules, and I was pretty amazed. It was some kind of a science I'd never heard of, and so as I was listening to the presentation, I heard about the actions that these molecules had on individuals with a whole variety of different health conditions and no toxic side effects. And I was just pretty amazed. Dr. Walker, who is up here in Spokane, he joined in the conversation to answer questions at the end of the presentation by phone. And so that was my introduction to an actual medical doctor that worked with this. And I had the opportunity very shortly thereafter to meet with Dr. Walker, and he gave the PowerPoint presentation showing the science behind this. And being a person that loves science, that was very important. I just didn't want some kind of voodoo solution that cures everything. And so he gave the presentation about redox, which is reductant. One of the things that really impressed me about this and bolstered my belief in that is Dr. Walker is double board certified. He's board certified in internal medicine and then also in emergency medicine. And he's really a pioneer in the field of emergency medicine. Up until the time he was going through, most hospitals, emergency rooms consisted of doctors that were either retired or working part-time that did have no specialty in emergency medicine. And Dr. Walker spearheaded a program and actually was one of the co-founders at a local hospital here about a little over 35 years ago. And so, one of the things I was looking at evaluating this was, is this something that's accepted by the medical community? And whether it is in general or not, I know it was accepted by a very well qualified individual in the medical community. One thing that really got my attention about these molecules was something that was mentioned during that presentation, and that was that people with cuts had immersed their fingers with a bleeding cut into the solution and had immediate clotting and immediate resolution of that. And for me as a dentist and doing lots of oral surgery, that was intriguing to me because in the back of my mind, I was thinking, what could this do when I extract a tooth? So, anyway, as far as the science, if you think about physics and particle science with the physical sciences, you have atoms that have the nucleus, the protons, the neutrons, the electrons spinning around. And we used to think that was it. But then we found out you can break those down into quarks and muons. Well, it's similar in the study of redox signaling molecules. And the study has been since the early 1990s, but there have been thousands of articles on this. And it's pretty much the leading edge in biologic science. The big problem is that not much of this knowledge has even reached the medical world and medical schools at the level of practicality. But as far as the science, for a variety of people that are on this call as an audience, there are going to be lay people and there are going to be health professionals. And I want to just address lay people first. These molecules are made in the cells in the body during a process where the cells are creating energy within themselves. It's a molecule we call ATP. And the molecules are produced there, and then they act as signalers inside and between cells for different cellular functions, and also in properly maintaining the cells to protect the cells from damaging chemicals and substances, to detect when a cell is damaged, and to help either repair the cell or signal for replacing the cell. And this is the way that our bodies deal with various challenges and heal themselves when they're damaged. Now, to the healthcare professional, we all know we studied for the boards and we memorized the Krebs cycle. And most of us have forgotten all the different interactions at each step. But just in quick review, there are 8 steps. And at each of these 8 steps, we have a chemical reaction that results in redox signaling molecules as one of the products. Now, those used to be considered waste products up until the early study of redox signaling. And the interesting thing is that there are 16 different molecules, and they are made up of sodium and chloride that have the water as the catalyst base. And those are all made from the body's most abundant resources, then water and salt. And it was about a decade ago that an atomic medical physicist, and that's just a word for a very smart man, found the breakthrough to create the same molecules outside of the body in a stable form that could be ingested to bioreplenish these molecules in the body. And so you can see our body, what happens is over time, our body makes less and less of these as we age. So healing and old cell replacement occurs less frequently. That's why a 10-year-old can fall and skin their arm, and a week later you can't see the wound. Whereas a 70-year-old can fall and have the same injury, and yet you might see the scar and damage from that 1 year later or months later. I got sort of sideswiped with this new information. And the thing is that I feel like I'm fairly well informed as a healthcare provider. And how could I, as a healthcare professional, even trying to keep up with science, have never heard about this, never heard about redox? And so then the question is, well, what about other people in my field? What about other people in the medical community? How many people know about these molecules? We know what we've been taught. And it takes, we don't know what we don't know. And, if we assume that we know everything about everything, I would consider that arrogant ignorance. And so anyway, it's wonderful science. There's a verse that talks about a prophet not being welcome in his own country. And my sister and I introduced this to my father, and um, we have our father today, I truly believe, in the condition that he's in, because we snuck this to my dad for months. We snuck it from our family. And, and today, my dad at 94 years old just recently got up at a family gathering. One of his younger sister at 86 years old was complaining about the things she couldn't do because of age. And my dad got up out of the chair and did 10 jumping jacks in front of everybody in that crowd. And and not having any pain. Now, a 94-year-old that has had inflammation in the joints of his fingers and other areas, not having any pain from doing it, jumping jacks, that's incredible. But anyway, it's there's something called cognitive dissonance or willful disbelief that people often run into when you're presenting something with a new technology that makes a huge impact on somebody's life. My initial, well, with as far as my dad and my mom, she has a condition that's affects memory and slower thinking with time. And people that are familiar with this, they'll have a loved one that's in a room and they're there, but they're really not there. They're not interactive. And that was a picture of really the condition my mom was in. And it's been sort of like pouring water on a wilted flower. Her personality has come back. And so not only did we get my father back, but he got his wife back. As far as my own experiences, the main experiences I had early were minor. It might have been spraying a little the Redox molecules onto cuts or burns and having very quick resolution of those wounds. But I did have another incident that happened in the fall of that year. It was September of 2014. I got a cat bite and didn't realize how dangerous they were. But you can see pictures here. This was the day that this was probably an hour after I got home. And I took pictures on the left-hand side. That shows the palm side. I got two fangs up into the muscles in the palm, the base of the thumb. And then on the right-hand side, it's sort of blurry, but you can see a little bit longer wound. And that is a fang that went actually into the knuckle of my hand, right on the thumb. I can't remember the name of the bone in the joint, but I had a severe infection that actually got into the bone from that one. And this is the second day after that bite. There's a bacteria called Pasteurella, which is extremely dangerous. And but you can see that the thickness of my hand on my right hand is almost twice the thickness of the one on my left. And you can see that the skin has been stretched tightly due to the cellulitis. And when I say cellulitis, to those that are not familiar with it, that means we have an abscess in the tissues and it's spreading through the layers and producing pus underneath the surface of the skin. And it's so generally you'll have warmth in the area and sometimes pain. Okay, now, so we went from that 5 days later. Of course, I felt like I had to complete some work obligations, so I did not go to the doctor. And so I got a emergency surgery 5 days later, same hospital that Dr. Walker worked at. And this is what I saw when I woke up and had my bandages removed. So you can see they left the wounds open for drainage, and which was great because this gave me a great opportunity to try out the Redox Signaling Molecules in the wounds itself. So I was able to spray directly in the wounds every time that I changed my bandages. Now this was just under 2 weeks after the surgery, and you can see I do not have any inflammation around my wounds. It should be red and puffy. but the color of the tissue of the skin all the way up to the edge of the wound is normal. And the wounds, you can see that they have recovered quite nicely. In fact, the one on the right on the palm was almost completely closed over at that point. And this is less than 2 weeks after the surgery. Now, just over a month, 36 days now, I had a couple of post-surgical follow-ups, and this was at that point. You can see that all of the wounds, except for the one on the back of the thumb, have healed over, except for the one on the thumb. There's about 1 centimeter left of that wound. And you can see that the color of the tissue is a nice light pink color. And so the hand surgeon, he's one of the best hand surgeons in the Northwest, according to all the doctors. And he said he normally wouldn't see this kind of healing until about 2 or 3 months. So this was at just over 1 month.
Fantastic. So I believe it was after that experience that you actually began using Redox molecules with your patients. Is that right, Dr. Rodkey?
That's correct. After being off of work for 3 months, I started to do some work at a county jail. And at that jail, you can imagine the only kind of dentistry I did was helping teeth see sunlight. And so there were a lot of abscessed teeth, horrible dental conditions, and I extracted several hundred teeth during that 1 month period, starting that first month. But in that full month, I started to use these molecules by flushing out the extraction sites, and found that the bleeding stopped in big wounds just like it did in scratches and cuts. And so I did find a more efficient way to deliver those to the wounds by cleaning out the socket, drying it out a little bit, and then saturating a gauze and putting that on top of the wound and having the patient bite on it for about 2 minutes. And that was the only application of redox signaling molecules. And the great thing about this was I did not work with a dental assistant. And one of the problems I had in some cases was the ability to suture and being able to see the edges of the wound. And with this, the bleeding stopped to the point where I was able to do all the suturing without any visibility problems. The other thing that I noticed was that the wounds would recover more quickly. And for some patients had multiple areas in their mouth. So I would do one side 1 week, and then the next week I might be able to get back and do several other teeth. But one of the things that absolutely amazed me was not just the ability for this to make the bleeding stop at a quicker, it'll probably 1 to 2 minutes. Normally it would take about 15 to 20 minutes for bleeding to settle down and stop. But one of the things that I noticed when they came back was that the site that I had extracted from the week before had the appearance of healing or a recovery of about 3 weeks. And that was in a 1 week period of time. And that really matched my own experience with my hand. From my own experience and the experience I've heard from other people that are using the redox signaling molecules is that they have had improvements in their gum health. Reduction in what we call periodontal pockets. That's the amount of space between the gum line and the bottom of the pocket, areas where bacteria gather. Well, one of the things that we know from early studies is that these redox signaling molecules have an antibacterial and antivirucidal effect. And in the mouth, there are tremendous numbers of different kinds of bacteria. And so this is great for just normal everyday gingival health. And so some people actually use the gel form to brush their teeth. It's not one of the recommended uses, but some people do that and have had great results. I've shared this with a lot of people, and every once in a while I run into a special case that is just super dramatic. And there's a friend of mine from church that she came up to me at church, and I saw it looked like she'd been in a bar fight. She had a shiner that you wouldn't believe. and except it had stitches on it. So anyway, this is my friend Carol, and on the left-hand side, you can see, and the picture here is actually a little bit more washed out than the one I have, but it was nice and black and blue right underneath that. She had an undetermined mass underneath the eye. They didn't know if it was a tumor or if it was something else. It turned out to be something called a hemangioma, which is just a collection of growth of blood vessels. Anyway, she had that surgery done the previous week, and so I asked her, I said, would you allow me to try something to see if this would help resolve that issue? And so she said, sure. So this was taken on Memorial Day of 2015, shortly after the gel had been made available to us. And so we placed some of the gel right after this picture was taken on her eye, and then I left and went home. And we go back to that last slide. So while you're doing that, I just want to say that she called me the very next day. Well, I was unavailable helping a friend move, but she called up and exclaimed, Grant, this stuff is amazing. All the black and blue is gone. And so I told her, I said, can I get together with you tomorrow? And so this picture on the right-hand side was taken less than 48 hours later. Now, if you look closely, there is no swelling around the sutures, and the majority of the black and blue is gone, except for just at the edge of where the doctor may have placed an instrument. Okay, now the next picture is even more amazing. This was 6 days later on the left-hand side, no black and blue whatsoever, and her sutures are healing up nicely. You can see that her smile is getting bigger and she's getting more light in her eyes. And on the right-hand side, you can, with a close-up, you can actually see there's just a hint that there was even any kind of procedure. And now Carol has the area there where there is no evidence of that surgery or that scar. And she's very happy about that. This, it's called a Redox supplement. And the supplement's a great word to use in general, but in this case, probably a more appropriate word is bioreplenishment, because your body naturally makes these, even though it's doing less as you age. So you're actually replenishing and making up for what your body is not doing. So as these molecules go into your body, they actually act almost like a lookout tower. You have a lookout tower, and there's a forest fire that pops up 20 miles away. And they are the messengers to send the proper equipment, the proper firefighters, the proper mediators that the body uses to respond to injuries and disease and those types of things. Anything that's abnormal in the body. It could be an uncontrolled growth of cells. It could be a virus. It could be bacterial, a number of things. But as soon as it goes into the body knows exactly what to do with it, because it recognizes that as being something that it produces.
How often Carol was applying the Redox gel?
My recommendation is to do it, if you have something like that, do it 2 to maybe 3 times a day. These molecules are very, very effective, and all of the studies have shown that they increase the circulation of blood into the tissues very dramatically, very quickly. And so if you have a good blood flow to a wound, you're going to be bringing the nutrients and all those things that are necessary for repair directly to that site. And more importantly, you're going to be hauling off the garbage and the waste that needs to be taken away. So all those clotting all those bruising products, all those things were taken away, as well as the proper nutrients being brought in. So I would say 2 to 3 times. And if Carol is able to answer that on the chat, she can, but that, I would say that would probably be it. Oh, just another side note, just real quick with her. When we were talking about this, we watched a little video called ASEA Breakthrough, which is a great video that shows a visual illustration of what these molecules are and where they come from. But as we were doing that, she asked me, well, what other things do people use that for? And I said, well, sometimes people have pain in their joints that they'd like to put it on. And so the look on her face told me that that was an issue. And so she had a problem under the arch of her foot that was very painful. She couldn't wear certain shoes. And so I said, take your socks off. Let's put some on there. And so we put some on and continued watching the video. And within a couple minutes, she said, well, Grant, how quickly is this supposed to affect you? And I said, oh, within 5 minutes, you should start noticing something. And she said, it's already working. And so she's been able to resolve some of her foot pain. The molecules are to the skin like BBs to a chain link fence. For the people that are looking at this for the first time, for the layman, the temptation is to, well, I got to go talk to my doctor about it, because that's what all the TV ads say. Ask your doctor. And the problem is that probably 99.9% of all medical professionals have never heard of this. And so when they're presented with something they don't know, and from somebody that is not as knowledgeable as they should be, they often have the tendency to disparage and to dismiss it as folklore or some other kind of thing. It'd be similar to going to the produce department in your grocery store and asking them for wardrobe advice. So you actually want to go to somebody that actually has experience, somebody that has studied this. And so if you do go to your doctor and talk to them, please do not be discouraged by their dismissive comments. It's just that they haven't caught up with the science yet. And the similarity to penicillin, it took about 17 years for penicillin to be accepted as a viable treatment. And so I think if you don't have knowledge on a topic, you're not authorized to give an authoritative opinion. And that, I don't care what kind of level you've achieved in your studies, your DMD, your PhD, your piled higher and deeper. You don't have the authority to do that if you do not have the knowledge. So if you're a doctor out there and you're giving people dismissive comments about this, do your research first. Give a qualified answer. So that's what I say. And there's plenty of science there. If somebody wants to look that up, the PubMed.gov has lots and lots of articles, thousands of articles about how redox signaling molecules affect the body and the health.